The coronavirus has now surged past 9 million cases in the U.S., with at least 6 states breaking daily records for new cases. And in many remote areas, hospitals are at a breaking point. Our Gabe Gutierrez got exclusive access inside a COVID ICU in a growing hotspot. I have to tell you, some of what you're about to see is hard to take.
St. Vincent Healthcare in Billings, Montana wasn't always among the front lines in the war against COVID. It is now.
I'm a good nurse. And the nurses that I work with are good nurses, but we are broken.
Joey Trawick says he's personally held the hands of 23 of his patients who have died after the first one passed without him.
And I came back to the room at one point and she had passed by herself. And I thought, I'm never going to let that happen again. If I have to stay late after work, if it means coming in on my day off, they're not going to pass alone on my unit. Again, none of them.
The hospital granted us access with the permission of patients' families to show the devastating impact of the virus. Billings is a city of more than 100,000 people, but this facility takes in critical patients from across the state.
This is one of the hospital's 3 COVID units. At least 14 patients here are on ventilators right now. It's a minute-by-minute struggle.
It's been shocking to me how fast it's accelerated in the last couple weeks.
Dr. Chris Spangen works in the ICU.
You know, a lot of times these 12-hour shifts, they'll morph into 13 and 14-hour shifts. There's just too much to do, and we just can't get it all done.
How close are you to being at capacity right now?
We're close. We're very close. We can probably find beds, but it's going to be at the expense of non-COVID patients.
She came out of retirement earlier this year to rush to New York. Now she's back. The virus followed.
This patient may or may not survive.
She showed us one patient still intubated. Another had just come off his ventilator.
He's improved, but that doesn't mean he's out of the woods yet. He is still very critical.
The toll here is mounting, both for the patients and their caretakers. Joey Trawick has self-isolated for months, sleeping in his basement, away from his wife and 3 kids.
How hard is that for you?
It's a huge impact.
This is why he does it. Late today, he visited one of his patients now in recovery, out of isolation.
He gets to get off of the COVID unit onto a different floor where he can have a visitor perhaps. It's like we've won.
All right, Gabe joins us now. You have been covering this pandemic for months. What struck you today?
Lester, it reminded me a bit of what we saw in New York months ago. The healthcare workers we spoke with today say they're frustrated that more people haven't been wearing masks. They wish at least some of this could have been prevented.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.